Endolift, we're using laser energy. We make a hole in the skin. We introduce the fiber optic cable under the skin, and we're melting the fat, right? So we're fanning doing multiple fanning, linear burning of the fat. And then after we're done, we go in there with the cannula and we are sucking out the melted fat. And it's going to pull out not only fat, but also the melted fat. So we're going to have a little pinch, burn. Yeah, I know. Burn. That's it. Breathe, breathe. I'll wait a little bit, then I'll give you more. Okay. Feel a little bit. Maybe just a little more. Drink. Yeah, that's it. Good. We wait. Spray it, Joe. Thank you. Take it away.
Can I use gua sha today or tomorrow?
For the face?
Yeah.
You mean the steel, the bone?
Yeah.
Do it tomorrow.
Okay.
And just put the arnica gel or some lubricant, and
Yeah.
you can use it to gently push the fluid into your ears.
Right.
Yeah.
Right. Okay.
Yeah. When you go to Chinese massage parlors, they use the washer. Do you feel?
Mm-mm.
Okay, good. Pinch. There you go. Good.
The Chinese places do it?
Yeah.
Mm.
You go to they have lymphatic massage places. Not that I go, but I know some people go.
You should have someone in the neighborhood.
Yeah. So
when
refer
you have
to them.
someone like me, you
Yeah,
can
refer
send it
them.
to them. Yeah.
I'll ask someone.
It's easier for patients.
Yeah, I'll ask them. Spray. Okay, good. Thank you. Yeah, I'll ask them. So you're gonna feel weird, right? A little bit weird. Little burning. Little burning. Little burning. Yeah, burning. Little burning. You're gonna little burning. You're gonna have a crooked smile because of the anesthesia, not because of anything like we discussed before. This anesthesia, it's like going to a dentist. You get a little crooked smile. Okay, so you're doing great. The cannula is going into your skin really easy. That means you didn't have anything done here before.
Like what?
Like when people have threads, you get a little bit of...
I got nothing, thank God.
People who have facelifts, they have, scarring there. And it takes, you have to go through some scar tissue to actually push the cannula into the area I want. But yeah, this is really smooth. Can you turn a little bit? There you go. Okay. So what are you advertising on Instagram?
What is it?
What subject? What are you advertising on Instagram? What? Not Insta, TikTok.
So my daughter's, like I said, she's 25.
Yeah.
And she lives by herself.
Uh-huh.
She has 2 dogs,
Uh-huh.
and she kind of like shows her entire day what she does every day.
Okay.
Yeah.
Did the American company take it over or something with the TikTok issue?
No. Nobody takes care.
Okay.
Yeah.
No, American says you gotta sell it to them.
So if you sell a lot,
Mm-hmm.
like if you do a lot of videos and stuff,
Yeah.
you get paid for it. For
Yeah,
stuff that
monetizing. Yeah.
for the advertising. Like,
Right.
let's say I'm putting my face stuff. What did you put in right now?
Numbing.
Just
lidocaine. Yeah.
Okay.
Lidocaine with epi.
So, like, let's say we put it on and you get tons of people.
Yeah.
She gets her services for free.
Oh, okay.
Yeah.
I see.
Or if I send people in here and you get at least 1 or 2 people out of the month, then you and I have business together.
Oh, okay. A little pinch. Pinch, 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 pinch. Yeah, pinch. This is the only thing you're gonna get. That's it.
I know. I hate that. It's like the numbing cream you put in your teeth
Yep.
and the
Teeth.
gum.
Right. I never did oral block, but I done facial blocks.
Oh.
Facial blocks, you know, when I do laser procedures, sometimes it hurts. So, you know, there's areas on your face where the nerve comes out. There's one
Yeah.
right here.
Okay.
Right there's a nerve, infraorbital nerve comes out of here. There's one there's a nasal branch over here. You have a supraorbital notch here, and there's a trochlear notch, and then I physically put a needle through your skin into that area and numb it, so your whole upper forehead is numb.
Oh, wow.
And then you do it in front of your jaw. There's one here called a mental foramen. I shove it here. And there's one here with the buccal area. So you go from the tragus to your mouth, and you go 1/3, and you have one buccal nerve come out of here. So when I do like CO2, something that hurts, I block them.
Oh.
Block them here, block them there. And yeah, most I know like a lot of med spas don't. They're not very aggressive in blocking. I don't want any of my patients to hurt.
Yeah, exactly.
So I block patients, you know. As an ophthalmologist, I stick needles in the eye.
Shit.
Of course, I put, you know, retroorbital block. I put a needle under the orbit eyeball and put the fluid behind the eye.
Oh my God.
So I pretty know the anatomy of the face. So, yep. So you get a real good block. They don't feel anything.
Okay.
But then downside is that you have a droopy jaw.
Yeah.
That lasts for about 4 hours. Like going to the dentist.
Yeah.
You get a droopy jaw.
Should I be wearing like a neck and face mask?
Yeah, I want you to do the under chin band-aid.
Yeah.
Yeah, I need that.
Do you recommend anything, any kind, or?
Oh no, I mean I can give you a link. They're pretty much the same. It's not any specific brand. There's nothing I recommend for it, but I can give you a link that what you can buy on Amazon. I like this one. It's nice and bright. Yeah. This is a keeper. Okay, so to give you another block. Okay. So
How long does it take?
this thing? Well, more part of the face, longer it takes. You feel anything here?
Mm-mm.
Okay, good. Ooh. Okay. Okay. I'll make a different hole. There's a little vessel here. It's bleeding a little bit.
Mm-hmm.
How long does it take? It really depends on the person, how much fat they have in their face, the areas of the face that you're treating.
Mm.
And so, if you do the whole face, the eyebrow, upper lid, here, the jaws, it could take up to 3 hours.
Mm.
So, but it really also depends on the patient's tissue. Some people it takes longer. Let's see, it's bleeding here. How about this one?
Mm-hmm.
You feel?
Mm-hmm.
You do?
A little bit.
Okay.
It was a needle, right?
Yeah, the needle. You're bleeding here, so.
Mm.
Sorry, I'm just gonna. So I'm gonna put one here, one above the jaw, and then I'm gonna go underneath the jaw to get this area here. And then we're also gonna do right underneath the submental, right under the pointy chin area.
Okay.
So I put the cannula here, and then we'll melt the fat there.
Okay.
And then under the eyes. So I'll do it here a little bit and tighten it under the eyes, okay? So right now we're just going. Okay. How about you feel there?
Mm-mm.
Okay, good. And that one doesn't bleed, that's fine. Alright, so I'm just gonna put some numbing medicine here. Right here. Right here.
How soon can you do makeup after Endolift?
I recommend not putting anything on for about 3 days, 4 days. I mean, you can put the makeup on, say, not in the holes.
Yeah,
You
the
could go
whole
around the
area
holes.
normally will get infection.
So I don't want anything to go in the holes. You're going to be wearing a Band-Aid, but oh, sorry, a little burning here. If you can put makeup around the area, not in the hole. You could do it. I recommend doing it like on the 3rd day or 4th day, but not a full foundation kind of thing.
But I'm going to be wearing a Band-Aid on it anyway.
Yeah, you're gonna wear a Band-Aid.
Yeah.
Okay, so now I'm gonna start from here. I'm gonna start working in the jaw area. Okay. Also, I gotta highlight this area. So go in here. Sorry. Yep. Okay, good. And massage now. So now that I put the numbing medicine here, what I'm doing is I'm actually pressing it, because if you have a lot of fluid in there, the laser really doesn't, your fat doesn't absorb the laser, the water does. So right now I'm just pushing the fluid into your face and spreading it thin. Okay. If it's like a bag full of water, none of the laser energy going into your fat. So I have to give you enough so you don't feel it.
You're actually like trying to
push it away.
To remove the fat or tighten the skin? Or both? Okay.
Yeah.
Because I didn't think I needed to remove any fat from the face, no?
No, you have here. What happens is this fat pad was up here.
Oh.
See, this is
It
when,
moved.
yeah, when you're younger, you have really no nasolabial folds.
Yeah.
But when you get older, this, the fat pad moves down because your face drops.
Ah.
And because your face drops, then you get the line.
Yeah.
So there's two ways of actually diminishing this thing. People use filler to hide this area when you
Yeah.
put it in line, so it makes it more smoother to look like if you have no fat pad. Or you can just go in and melt the fat.
Yeah.
Or
Okay.
you can go in, you can do thread lift. You can put a thread under the skin and pull your face upwards. But since we're not doing that, I'm just gonna thin out the fat pad here.
Okay.
I'm just gonna
And tighten the skin on top.
tighten the skin on top, and also I'm gonna do here. So because all of this was here over your cheeks,
Yeah.
but when we get older, everything goes that way, falls,
Yeah.
and that's why you have this
Even though, like,
fullness.
I don't mind fat where you touching with your
Yeah, but
right hand.
I'm not gonna get rid of all of it. I'm just gonna contour it so that it's not as noticed. I'm trying to hide the fact that your face is fallen.
Yeah. Okay.
Yeah. And then I'll do the eyes. I'll do here, jaw, top of the jaw, and then I'll go eyes and then under the jaw, okay?
Okay.
Yeah, it sometimes takes longer. Some people jump at everything. I put the needle in, ouch, okay, and then I put the cannula in, they go, ouch.
Mm-hmm.
Or some people are very nervous, they go, doctor, what are you doing?
Mm-hmm.
I'm putting the cannula in. Okay, oh, what are you doing? I'm injecting.
Well, the thing is, people
Very
do
nervous.
get very nervous.
Yes, I know.
Some people would like to be knocked out so they don't have to pay attention to anything.
Yeah, it's not necessary.
Not at all.
Yeah.
And some people's body cannot handle the knocking out.
I mean, I can give them Valium, but it's not necessary, really.
Have you ever tried the laughing gas?
I have laughing gas.
Have you tried it on someone with
For
the
Endolift?
Endolift?
No, I didn't, but I guess I could offer that. I mean, those are the people who are really nervous.
That's what I'm saying. Like, it's
Yeah.
probably like knock them out for a little bit at least. They don't
But-
have to feel anything.
But the laughing gas doesn't last that long.
It doesn't, like, you have to constantly
Yeah.
like huffing and puffing.
Right, so that's why it's going to get expensive.
Yeah.
And
Yeah,
it's not even long acting.
No, it's
You suck
not.
on it and then you feel,
But it's actually pretty good. It blocks everything.
well, it doesn't really block, you just don't care. That's what it does. Nitrous,
I love it.
nitrous oxide, you feel the pain, but you don't get that anxiety from the pain.
No, I actually didn't feel the pain. I did
Oh,
Morpheus.
yes.
Morpheus is painful.
Yes, I know. They tell me. And people, like, especially like that, I do facial block. I block the face.
Perfect.
And so that they don't feel it. Morpheus has the current ramp. It goes
Yeah.
up really quickly,
Yeah.
and that's why it hurts.
Oh my god.
I
that
have-
hurts so bad.
I have Pixel 8, which is a radio frequency microneedling. The ramp, the current ramp is more gentle. It goes up slowly,
Oh.
so it tends to hurt less. Every person that has Morpheus goes, oh fuck, that
Oh,
hurts.
hell no. I would never do it again.
So doing the Pixel 8 is less painful.
Yeah.
Okay, so now we're gonna start, okay? So let's go here. If you tell me if you have any pain, okay? Put it here. Now the surgery really begins because it might take a while. Okay. Any pain there?
Mm-mm.
Okay, good. Put the laser closer to me. You hear the popping?
Mm-hmm.
Yeah, that's
the fat burning.
that's the fat burning. Okay, good. There's the jaws. I'm gonna get the jaws. We have a little notch here. This is where the facial artery comes up and connects to the angular artery. So usually the jaws are in front and on the side of that. Most of it is in the front of it. So I always touch it where I'm putting the laser, so I know where the
tip is?
the notch is. Because I don't. This is where the vessel is. I don't want to burn the vessel. Smile for me. Smile. Yeah. Okay. The nerve. It's not the nerve. I just thought it's the anesthesia.
Yeah.
Yeah.
But when you were putting the numbing, my smile was going away.
Yeah. And then, at the tip of the laser, you have to keep cutting it off because you get a little bit of a carbon buildup at the very tip of the laser, so you have to cut it off. So when I first put it in, there's no carbon buildup, but then as you keep lasering, carbon buildup. And now that it's nice and bright, because there's no carbon, also there's more popping. That means the laser is going. And so how do I judge it's enough? I just keep touching it. It's elevated before, and then as I laser it, the fat shrinks and then it goes down and it gets more firm. It's already firm, and it's also more lower because the fat's being.
Wasn't it from anesthesia?
Well, the part of it's from the anesthesia, but also I'm burning the fat. So it's elevated, yes, from the anesthesia, but also the fat's there. And now that I started doing it, it's much more. It's less elevated already because the fat's being burnt there. And that's how I judge what effects you're having.
Yeah.
And when do I stop? It's like, okay, when I see that it's low enough and the body is tensed enough. Yeah, see, it's already tense here. I'm going to work over here a little more. Yeah, right there.
I feeling that.
You feel that? Okay, yeah. I didn't get the anesthesia all the way down there. I'm going to do it now. Maybe I'll go from here. I'll go from here. Yep, there it goes. Yep, here. I'll go over here. You're not going to feel much. It's already working. Just keep going, and then I go to a point that I feel that it's enough. And then I go over here. So it's like painting, sculpting.
You go as you feel like it's needed.
Yeah, so you go, just keep pulling on it, see if it's, okay, it's tighter, and Okay, do you hurt now? Okay, good. Okay, that's good. Now let's go start working some here. Smile. Yeah, okay. It's fine.
Look at my smile.
Yeah, it's fine. Okay, so then. You know, before the Endolift, people used to get the bulgal fat removed from the inside of the
My
mouth.
sister removed it.
Yeah,
And I was mad at her.
that's a bigger surgery.
It is. And she doesn't need to remove it because she needs it as she gets older.
That's true.
And we need a lot of fat on our faces. Otherwise, it's going to look like a freaking witch face.
Yeah. Most
People really think that I have fillers in my cheeks.
Oh, yeah, because you have very prominent ones.
Yeah.
Yeah.
I'm like, no, thank God, that's from my mom.
Pain?
No, there was
Pop.
something. Yep, whatever that was.
Okay, so first I'm gonna work here. So yeah, like I said, but most of the fat, you do have a prominent fat pad, but over here you have it here. So like I said, that used to be here, and then now you got it down here. So I'm just trying to make it look like as if you don't have this face drop. Okay. Okay. Yeah, just a little bit here. Looking good already. Just a little more here. You're gonna have a lot of swelling on second and third day. I'm gonna give you some steroid by mouth. You don't no diabetes, right?
No.
No pre-diabetic.
And I'm working tomorrow.
Oh, you're working. Just wear a mask.
I am gonna wear a mask. I want to wear a very pretty mask. I'll make it.
You make it? Oh, you're gonna make one?
I'm gonna make something pretty, like how Egyptian wears them.
Oh,
You
okay.
know the pretty hanging one.
Oh, okay.
Yeah.
You're Egyptian? No.
I'm not, but I learned their tricks.
Okay. I think that's good enough. Just a little bit more here. To very tiny. Okay, good. That's good. I'm just gonna.
Can you see the difference of each side?
Yeah, it's elevated now. It's lower. So I'm trying to figure out, it's more, just looking, see what I think would be make your cheek.
Do you think I'm gonna need like a touch up if you see it's not Like some of the area didn't take a while.
That I usually wait 3 months for that.
Yeah.
Some people ask me if she would touch it up,
Mm.
and then I do offer it. It depends how much a touch up are we talking, but on average, if it's minor, then there's like a very minimal charge, not like the whole thing.
Yeah.
Everybody heals different, you know.
Exactly. How often a person would need it?
Yeah, well, if someone is a really full face, I try to put as much energy as possible. But you know, sometimes it's too much energy for one sitting. I can't put too much in. So when I put it in, I do as much as I can, and because there's so much fat and energy that I put in there, sometimes they need a touch up.
No, I'm saying it's like for the skin sagging.
Oh.
How often do you need it?
If it's sagging part, you don't usually do endolift. If you have other sagging areas, you can tighten the skin with other modalities like radiofrequency microneedling. You can do you can also do it with lasers. I have a PicoShow laser that we can use to tighten the skin, make the pores smaller, and rejuvenate the skin to make it look new. Yeah, I think that's okay. This one will get a little bit more. Just a little bit more here. Spray. Okay, good. Okay, that's better.
How satisfying it is when you're doing it?
Burning at the popping?
No. When you see that the puffiness is going down.
Ever since I started giving my patients, I give patients prednisone. The swelling dramatically goes away much faster, and when they come back in a week, sometimes I ask them, when did I do your procedure? He goes, I did it a week ago. Oh, okay.
Wow.
I'm kind of surprised that a lot of the swelling's gone. And people are happy when you don't have swelling.
Yeah, exactly.
So put your chin there. Spray. And because the swelling's going way faster, they see the results faster.
Yeah.
And one person came in 2 weeks post-op, and then she has significant, hardly any swelling. A lot of it went away. She has a little bit of tenderness, but she was pretty good. And she said, I'm very happy. And I didn't have her pre-pictures in my phone. And I just asked, do you have a picture of before the procedure? She showed me, and then I just took the picture post-procedure, and I can see that it is already improving. Her face is smaller, and then she had these little, around the corners of the mouth, you have a little, like a parenthesis here, like that. I treated those because that made her a little bit older, the little things that's around the corner.
Yeah.
And that's much smaller. And this is 2 weeks out. If you notice it by 2 weeks out, it's going to get even better when she's healing up 2-3 months out. This is good.
Andrew, are you far or are you close?
I'm right here.
Do you mind if I could grab my phone?
There's your phone?
Yeah, I think I could hear it. Like, it's just sitting on top of my, it's in my pocket.
Oh yeah.
I'm gonna go through your stuff, okay?
It's in my jacket pocket. Yeah, you could go through it.
I don't hear anything anymore. No more popping.
Thank you.
No problem.
Okay, so we're doing good. I'm doing good. I'm gonna work here. Okay. You feel anything here?
Mm-mm.
Okay, good. Okay. No, throw it away. Take it. Take it. Gauze. I need you to open another gauze. Put it on the. Okay, so here. Okay, good. So here we go. Okay. So now I'm gonna go and spray for me. I'm gonna go under the jaw now, okay? Okay, oh well, before I go there, I'm gonna do your eyes. I'm gonna tighten the skin on your eyes. What? Yes, chill. Okay, good. Look up. So, pinch. Pinch. You're gonna have a problem closing your eyes a little bit.
Really?
Yeah, a little bit. Because
For how long?
until this anesthetic wears off.
Oh, okay.
I'm gonna give you a lot of artificial tears to use.
Okay.
This is the orbicularis muscle. This is the muscle that closes your eyes.
Yeah.
So now I'm putting numbing medicine on the lower lid.
Okay.
So the lower lid is not as bad as the upper lid because most of the time we close our lid with the upper lid.
Yeah.
But then the bottom does a little closing as well. But you might feel that you have a little bit of droop on the lower lid. Okay?
Just until the anesthesia.
Yeah, until it wears off. Feel it? Okay. Okay, good. Yeah, until the anesthesia wears off. Oops. Andrew. Here. See that?
Yeah. See it?
Yeah. Yeah. Throw it away. Spray for me. Good. Alright. I'm gonna put this cannula under the eyes. It feels weird. It feels weird, right? There it goes. A little weird feeling. That's it. And I'm gonna move it along. And then we wait, okay?
Oh yeah, it feels weird.
Yeah, it feels weird.
Oh my lord.
Yep.
Ew.
Yeah. Well, this is my world. I do everything here.
I know.
I stick needles here.
I'm not worried. I'm not worried.
Yeah, I know the anatomy very well.
I'm gonna blow some cold air on your eyes and it starts.
Yeah, you're gonna feel cold air, okay?
Okay.
So the cold air, if it feels really uncomfortable, you tell us. We'll back it off.
The cold air is for what?
Because your skin around your eye is so thin.
Oh my god, tell me about it. How can we make it fat?
Well, you can't. That's the thinnest part of your body. Spray, and it's supposed to be thin. And because I'm putting energy on your skin, I don't want to burn your skin. So we put a chiller or a cold. We blow cold air over your eyes,
Okay.
so you don't get a burn. Okay, so now we're gonna start the chiller. Put the chiller here. What do you have? Minus 20?
Yep.
Okay, good. Good. I have to change the setting. Because the eye is so thin, you have to change the setting. You have to make it weaker. And also, on the face, I do 50 milliseconds on and 50 milliseconds off because the skin is so thin, you have to lower the pulse, meaning 30 milliseconds on and like 50 off. So you don't want to damage this area. Good. Feel it? Pain? Good, good.
Even though my eyes are closed, I could still see the
Light?
lights.
Yeah, you see the light as long as you don't have pain. This is the easiest way to get rid of the puffiness on your under the eye, and also you can tighten the skin as well. Okay. Look up there. And just like the rest of your face, I just look at the skin response. Now it was elevated before. Now it's like the skin is getting loose because I'm melting the fat under here. Okay, you don't need too much. That's good enough. Especially right here. Get it right here. The eye. This part here. This part here, it's a big area. The swelling, you can push it to the ears, but the swelling around your eye, it takes longer to go away
to go away.
because it's a little confined space. We have lymph nodes around the eyes, but because it's kind of in a small area, the swelling takes longer. This one you can move it to your ears with the massage. It's hard to do that here, so it takes a little longer. Okay. Okay, need a little more over here. Okay, no wonder. I need a little bit right here. Okay, that's good. I'm happy with that. All right, so I'm gonna go work under. Put your chin here, okay? So I'm gonna start working under your jaw, okay? Give me spray here. Okay, good. Alright, so now I'm going to hey, give me a 18 gig. Okay, good. Let me spray it down. Good, thank you. Turn over. Okay. You're gonna feel a pinch. Pinch, 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 pinch. Pinching, burning. Not so bad here. Pinch. Okay, good. And we wait, okay. Pain? No. Okay, good. A little blood here, it's okay. Spray here. Oh, here's a gun. Okay, that's fine. I'll use this one. Okay, here. And I'm gonna. Good, good. Yeah. Ooh, weird feeling, yes. Weird feeling. Weird feeling. Sorry. Okay, good. Turn over.
That hurts.
That hurt? Oh, okay. Spray here for me. Good. It hurt, huh? Okay. Okay? That wasn't that, but this one. I think I was too kind of superficial. That's why you felt it. Okay.
That's right.
Now I'm going to numb it here. Good. So I'm going to do the same thing here on the other side. And I'm going to do here, there, and then we're going to finish off with the chin. And then after that, we're going to do your bulges on the neck, okay?
Yeah. My face looks funny.
No, it's much smaller already. It doesn't look funny. Yeah, it's much tighter here. Good, this one. Get rid of that. Okay, so
My
here.
eyes are swollen or no?
Eyes? No, no. It's lower because I melted the fat. Okay, so here we go. Uh-oh. Okay. Spray here. Okay, good. Alrighty. So
I was very curious of how you're going to film the whole thing. Shall I never met an actual influencer.
Really?
Yeah.
No, so normally I have the same thing, a tripod,
yeah,
and I put it somewhere that everybody's comfortable with.
Yeah.
You know what I mean? But now it's yours, so you're definitely comfortable with. And the thing is, people wants to see how it works.
yeah, sure.
People wants to know what it is, and then they want to know
Good.
the
No pain.
aftermath.
Yeah, before and after, of course. But also they want to know actually what's happening mid-procedure.
Exactly. And you know what it is? We don't have a lot of people who does Endolift 1
Yeah,
in New York.
yeah, that's true.
We do a lot in Miami.
Yeah.
Lots of it in Arizona.
Arizona?
Yeah.
Oh, okay.
And that's it.
Yeah, I see.
California, of course, it's beauty
Yeah, sure. All the celebrities there.
mecca.
Yeah, of course. I'm gonna put a little bit of. I'm gonna blend some fat melting in here.
Okay.
Fat melting is 980 nanometers.
980.
980, yeah.
Okay.
Tightening is 1470 nanometers. So what I'm doing is, you can't use 1470 on your face because the 980, the heat dissipates too greatly. So from the end of the fiber optic, there's more heat, and the heat spreads more with the 980.
Oh,
So that's why you can do it under the
chin or under the jaw.
Yeah, under the jaw.
Yeah.
You have a little. I'm sorry, you have a little.
What?
Just a little bruise here, tiny one.
That's okay. I'll survive.
So right now I blended more 980 with melts the fat. And the 980 doesn't really pop. 14870
I was just
does.
going to ask you, how come it's not popping?
Yeah, because I lowered the 1470. You'll hear some popping, but much less
it's
so.
not that much.
But it's there's more heat here.
Oh, okay.
Less popping. Over here is all popping.
I was afraid I'm going to feel it a lot.
No. Yeah, a little bruise here. That's okay. Yeah, so it's I have a video with the chicken.
Yes.
Yeah.
Yes, I saw that.
Right. The one that shows the popping is the 1470, and ones that kind of not popping but melting the fats. That's the 980. So the 980 doesn't really pop. It just melts the fat, and because there's more heat generated here, and the heat spreads. You can't do it here because there's too many important things like nerves.
Yeah, exactly.
Over here, you just have less, no major nerves here, just fat
And
skin. Yeah,
Yeah.
no major nerves or anything like that. Yeah, so I can go in here and not. So that's why I could put in the 980 in there. Okay, so. Yep. Yeah, but I do like hearing the pop too.
That's what I was telling you before, how satisfying it is.
Yeah, to hearing the pop, I love it. But actually, the patients not only hear it, but they actually feel the pop. Yeah, it's a vibration. It goes into your ears.
Yeah.
You could hear the pop.
Yep, like how I was
The
seeing
vac-
it in my eyeball.
The vibration, you could feel it. Okay, so here. Okay, I think we're getting there. One more. See. This, okay.
How could you see it from the side like that if you push it to the side?
Oh, I can see the elevation.
Yeah. Okay.
You know, people do liposuction for under the chin, but that doesn't really address the loose skin.
Exactly.
So
My sister was telling me, why don't you get liposuction? I said, I don't have that much fat though.
yeah,
And what am I going to do with the skin?
yeah. I mean, you know, Endolift will tighten the skin, but there's only a certain amount that it can tighten.
Correct.
If you have a really loose, like a bulge, second chin, really, even when you do the Endolift, it'll tighten it, but it can't get rid of all that skin.
Yeah.
And that's when you need surgery.
That's when you need face.
You know, they need a chin lift.
Yeah.
You know, you have to cut the chin and then suture
Pull it up.
back, and there's a suture line under the chin.
Yeah.
Okay, I think I've pretty much here. Okay, so I'm gonna start working. Wait a minute, I'm gonna a little bit here more. 제가 언제 끝나게 필요해? When's the consult time?
Starting at 3.
What time now?
It's
1:14.
1:14.
Okay.
But I always tell them that there can be a little bit of a delay. So
Okay. All right. So can we switch over to the other eye?
Can I go to the
Bathroom?
The restroom, please?
Yeah. Mhm.
And it electrocutes you.
Yeah. I did one. I haven't done that many RF. I combine the procedures a lot. The Endolift and the RF frequency.
RF?
Yeah.
Okay.
It's you know, if I'm not putting that much energy in, then because you're doing it from the inside,
Yeah.
and then you do the RF energy to the outside, right?
Yeah.
So that helps. Oops. Okay. I'm gonna. 이거 새 거죠, 한 개.
this is the first time someone's saying that there's something that beats birth pain.
Yeah.
I'm really surprised.
No, birth pain is painful, but God has His own way to make it easier. Morphine, nobody has anything to make it easier.
Yeah, no, those things I block people.
Good.
I've done that on a patient. Yeah, people are different. I've done it, but then they wanted the nitrox. I mean the laughing gas because it was in pain.
Yeah.
But she was also. It wasn't. I don't think it was necessarily that painful. Yeah.
I think she was nervous.
She was nervous.
Yeah.
She's a nervous person.
Because people
Lower
that
here.
they're nervous, and nervous people always will have issues.
Yeah, more.
Thank God I'm not
Okay.
a nervous person at all.
That's good. That's why it's going quickly.
Yeah.
When they're nervous, it takes almost twice as long. Okay, so heads up. Okay, good. Yep, head down. Thank you.
Do you need new clamps?
Huh?
Do you need new clamps?
No, that's fine. Clamps okay.
If I would be here working with you, trust me, I would be doing all of your patients. I love these things.
Oh, you do?
Yeah.
Some people love it. That's
Yeah.
their job. I mean,
It's not my job.
I
but
mean,
I
that's
would love to be my job.
I mean, people love that. I mean, I was briefly dating a girl, and she was like, really want. Of course, you know, she gets the girlfriend discount, but she was very proactive in everything. Says, can we do this? Can we do that? And they're doing this in LA, and okay, sure.
Yeah, I would do anything like to patients. Like I would be helping you.
Yeah, she was very proactive. Okay, there you go. Good. We're gonna turn over here. Okay, so spray 저기 불 저기 켜. 그 이쪽에 할 거니까 이쪽에 오시지. Okay, so yeah, see this side is much smaller. So yeah, so you need most of it here, a little bit here. Not much.
It's mostly I feel like my jawline, under my chin.
Yeah,
Those are the areas that
yeah,
is.
sure. Those are the area we're gonna fix. Pinch, 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 pinch. Burning, 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 burning. Oop. Burning, burning, burning. Okay, so we wait, okay?
Do you want it closer?
Yeah, that's okay. That's good. Yeah, that's good. You 붙이세요 이렇게 해서. Yep, thank you. Okay.
I like that light.
Yeah,
It's so good.
it's LED light. I thought about mounting it in the ceiling, but that's a lot of work.
It is.
It's expensive.
You need my husband for that. He's an electrician.
Oh yeah, but actually you have to mount it into the ceiling, and yeah.
That's his job. He knows how to do it.
Okay.
Yeah.
I said I'll just buy one LED with the stand.
No, I love it. It's so bright.
이쪽에 이거 앞으로
What's your arm?
Okay.
Good.
Yep. Okay. You feel this? Okay, good. You felt that? Okay. Well, you wait a little more then.
I have a lot of hollowness under my eyes. How do you fix that?
You can inject it with PRF, or you can use a filler. Yeah.
What does the PRF do?
PRF is platelet-rich fibrin. Fibrin. Oops, sorry. The burning. Platelet-rich fibrin is the clot, the protein that makes the clot. And there's you take your blood, you spin it down, and then you
Like
PRP.
PRP,
Yeah, PRF, the same thing, but it's this, instead of the plasma, we're using the fibrin, which is the
red cells,
no, that's the protein that creates the clot.
the yellow one.
Yeah, yellow one, but it doesn't have any anticoagulant.
Okay.
PRP has the anticoagulant,
Yeah.
and PRF has nothing. So
you inject that into
the face.
Really?
You could do two ways. I mean, if you want, in this case, you want some volume, right?
Yeah.
And you you make a gel out of it. You take the fibrin, you put it in a cooker at 75°C for 10 minutes, and it becomes a gel. Essentially becomes a clot.
And then you inject it under your eye?
Yeah, and you take that clot, and then the rest of the PRF and the liquid form, and then you push it back and forth between a syringe, and it'll soften it. Because if you leave it, it's too thick. So you soften it by pushing it between two syringes back and forth.
Right.
And then it gets softer.
Okay.
And then you use that as like a organic gel, like a filler.
Your own filler.
Yeah, own filler. And then
how long does that last?
they say about a year.
Okay. How much does it cost?
Not much. You may need usually need more than one.
More than one
session, yeah. Treatment.
Like within how much?
You do it once, and then like a month and a half later, you do the second one.
Okay.
Yeah. Actually, I have a Groupon.
Okay.
If you want that, we can. I'll honor the same price, and you can do it.
Okay. So I probably will, when I come back for my
turn over. Yeah, so how long here? Okay.
when I come back for you to look at my face,
Yeah.
we'll do it.
Well, because we did this, we're not going to do it anytime soon. So once all that swelling goes away, then we can treat. Then we can do it then. So we're talking about a couple of months now.
Yeah.
Okay. Okay, let's talk a little numbing. Burning. Burning. Sorry. Sorry. Okay, I'm gonna wait until it kicks in. Oh, burning. Burning. Burn. Burning. There you go. Good. Burning. Okay. Should be really numb. And lastly, this way. Yeah, everyone who had Morpheus tells me that hurts. Sorry. Oh, sorry. There it goes. Good.
It's 1 second of craziness.
Okay. Now, going to. Okay, so turn. Good. A little burn here. Pinch, pinch. Pinch, 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 pinch. Okay. Pinch again. Oops, sorry. Okay, good. We'll stay. A little crochet.
That's my daughter who's blind with one eye.
Yeah. Oh, I see. Yeah, she looks like you.
Yes, she does. And she loves it.
My daughter looks a little bit like me. Some people say she looks a lot like me.
They normally look like their
Fathers, yeah, that's what they say.
You only have one?
I have one son and one daughter.
How old is your son?
27
Okay.
and 24.
What does he do?
He does real estate in Miami.
Oh, nice.
He does commercial stuff. He's kind of just starting, so he's trying to make his way, connections, and it takes time to close deals. It's not easy, but he's slowly getting there. Yeah.
That's okay. He'll get there.
Yeah. He's a good talker, so real estate, that's what you need. Talk.
No, you're pretty good too. So I guess he got it from you. My daughter is exactly like me.
In what sense? What
She
exactly?
could talk to the walls.
I see. Yeah.
I'm the same way. I could talk to anyone.
I get that from my mom. My mom has she's very loud person.
Really?
Yeah, she has a temper and she's loud.
Where's she from?
She's Korean. I'm Korean, and then my dad.
Koreans were loud to begin with.
No, she's loud. She has an Italian mouth. She curses all the time.
How come you didn't become like that? Loud.
I'm like my dad. My dad's quiet. My brother's like my mom. He's loud. He has a temper.
How old are they, your parents?
My dad's 90.
God bless.
And my mom passed away, unfortunately. COVID.
Aw.
Yeah.
I'm sorry.
Yeah, I know.
My father was 99.
Oh, 99. Oh, good age.
He died 4 months ago.
Oh, 4 months. 99 is good age.
It's a very good age.
Yeah.
He had stroke.
Stroke, okay.
And after the stroke, he couldn't walk.
Oh, I see. He was healthy until 99?
Yeah.
Oh, that's good.
He never had diabetes. He never had high blood pressure.
Yeah.
Thank God. I guess I got it from that.
Yeah. So. Okay, here we go. Little. Do you feel? You do?
A little.
Okay, then I'll give you more. So my mom, she talks a lot. She's loud, and so. But my dad's quiet. He's not loud. You can't have two people like that in a marriage.
No.
You can't survive. You're
Yeah,
gonna
one
be fighting.
person has to be quiet.
Yeah. So. I'm somewhat quiet, but I have my mom's side too, so I do talk. I'm a little blunt sometimes.
No, that's good. That's good. I'm always blunt.
Not in a cruel way, but. You feel? No, you don't feel good. The spray, Joe. Oh, they're good. And I always say I'm happy for my kids. They got the mom's luck, so they both have double eyelids, and the nose is higher. I have a flat nose. They have a higher nose.
You know what? Thank God for surgeries these days.
Yeah.
You can do anything.
I know, but they don't need surgery. They're fine.
That's all.
They got big eyes and double eyelids already, so.
What does double eyelid mean?
You know, the like me, I have one eye, like monolid. My crease is really low.
Oh.
When you have the higher.
Yeah.
You know, Asians get that surgery all the time to get a second eyelid to make your eyes look bigger.
Sure. And I'm the opposite. I need a lot of like filling in because they're like too deep.
This one, I don't want to go too deep. I just right here. I'm gonna go here. I'm gonna do very light, okay? Because this can melt fat, so I'm just going to. Yeah, I made this thing. This one was more puffy. Yeah, right. Left eye. It was puffier, so I got rid of the puff. This one, there's really no puffy.
Yeah.
I'm just gonna do really 1 or 2 passes just to tighten the skin. That's it. Okay.
Okay.
This one was puffy, so. Bishop.
150.
150. Okay.
140.
All right. 140. Okay, so spray it, JL. Good. Okay, good. Yeah, nice and green. Okay, good. So I'm gonna go in here.
I'm gonna dim the light a little bit though.
Okay. Okay, so you can hear the popping here because it's 1470. Smile. Okay, good. That's good. Okay. Okay, good. Okay, this. Pain? Okay. I don't need to go there anymore. Okay, pull a little more. Turn here. Okay. Maybe a little pain here. Okay. A little bit here. Yeah. Good. No. Smile. Yeah, that's fine. Okay.
It's not even
Yeah,
smiling.
I know it's done. Okay, good. Very good, Joe. Good. Okay. How do you know they do it in Arizona and all the?
I do a lot of research.
Oh, I see.
I want to actually learn how to do it.
Okay. Where is it? Not here. It is okay. Okay. Good. Pain? Okay.
Right there, a little bit.
I can give you a little more.
Andrew, you good?
Oh, I'm good. I'm a little bored, but I'm okay.
Sorry.
Sorry. It's okay.
I'm not giving him much work.
I know.
Yeah, because it's going pretty well. If it's going slow, then I'm asking him to do more stuff.
Yeah.
But since it's going pretty well, not much to do. Chin up a little bit. Thank you.
Normally, I'll be on Dr. Lee's phone on the WhatsApp because we get so many leads coming into social media. But
This is the evening. Towards the evening, he's typically sitting next to me on my phone, answering all the WhatsApp.
we have too many consults scheduled, so
I know.
I didn't run the ad this time. So
You didn't? Okay.
not that much.
But I still see people answering, even though there's no ads.
I want to ask my daughter to reach out to you. She'll help you.
Oh yeah, I would love to help. Yes.
Yeah.
I need it.
Yeah,
You
just
could send her your stuff you need,
Mhm.
and she'll help you.
Does she edit videos full time?
Yeah.
Oh.
oh,
Okay.
no wonder. That's why she'll be quick.
She's so good. She's so quick.
Okay, tell me how much she charges. I'll do it.
Yeah, really, seriously.
Yeah, we're serious. Andrew's overwhelmed.
No, it's not Andrew's job. Honestly, it's you need like 2-3
Yeah.
people to
I
start
know.
doing that.
Yeah, I know. We're just kind of starting the social media thing, so
Yeah.
we didn't know the traction that we get. And when we first started doing Instagram, it went ding, 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 and then Andrew goes, "Doctor, it's blowing up." Yeah.
Yeah.
Ding, ding, ding.
You're gonna have to hire me then
Yeah, hire
to
somebody.
help you with your stuff.
How much do you pay her?
I don't pay her nothing. I do her hair. I do her microblading. I do everything for her.
That's
Boy,
it's
come
the
on
daughter.
Now. Come on now.
Daughter, you don't. No, well, I pay my daughter a little bit when she was helping me a little bit, but I do it just to she's just came out. I mean, she doesn't have a full-time job, so it's
My
like
daughter works full time.
it was like an excuse just to give her money.
Yeah. No, with my daughter, like if we do anything, we go out and she needs like groceries and stuff. I never let her pay.
Yeah, of course not. That's what
Yeah.
parents are for.
Exactly.
Yeah, never ends. Dad, I need money. I'm short on rent. Can you send me some? Yeah, okay.
No, my daughter has her own apartment,
Okay, that's good.
and she's only 25. She bought it
Oh, she bought it.
4 years ago.
Oh, okay, good.
She was 21.
Yeah.
She's a hustler.
Oh, so let's smile for me. Okay.
Oh, I
good.
can't.
I know. That's fine. Okay, that's good. Yeah, my son's trying to hustle, make some money. He was hired by this real estate company, but they were paying him almost nothing. And then finally, he got too good at his job, and then he didn't want to pay him, so he fired him. And he found out that when after he got to another job that he was getting paid nothing really.
Yeah.
So, like that guy was taking advantage of me.
No, you can do that. My son did real estate for a little bit.
Yeah. So. He talks well, so you gotta schmooze. You gotta, yeah, talking. He tells me he does 100 cold calls a day.
Wow.
It's like, isn't that hard? Like in the beginning, yeah. Now I just do it every day. It doesn't matter.
Now it's a second nature.
If God brings the money, he says, it's always luck. You never know. He says if you all of a sudden, person of a person, like, hey, I have a guy's looking for a place to put it in, and then he goes, yeah, I have a place, and then he closed the deal right away. So All right, so this is, do a little bit here, here. But he says, like, I said, son, you have a girlfriend? I go, no, not really. He's like, are you looking? No, I'm trying to make money right now. And then he says to me, the girls in Miami, they all want money. I say, what? What girl don't like money? No, no, no. Miami girls are even worse.
Yeah.
Oh yeah, okay. Well, most of them are very well in shape because it's so warm over there.
Yeah.
They have, they don't cover themselves in the winter, like here. And everybody has some plastic surgery there.
Most of them.
Yeah. He's telling me because he goes in the world of real estate, and there are a lot of rich guys there, old guys there,
Yeah.
rich old guys with 25-year-olds.
Yeah.
It's like, oh yeah, I know what the girl wants. Yeah. What else do you think? They're dating like a, almost 65-year-old or something. It's like, yeah, that's how it goes.
Andrew, you could learn something from my daughter, and she could teach you how to go live.
Go live?
Yeah.
On TikTok, right?
Live is so crazy. You will get so many people asking you questions.
Live?
Yeah.
Well, that means I gotta sit there and do live?
No, you don't have to do nothing. Andrew's gonna be doing it.
Oh, I don't know anything. Okay, I healed her.
You're gonna go live, and you're doing surgery while people are watching, and they're
Oh my
asking
God.
questions.
Oh, that
Where
might.
you at? Does it hurt? They're gonna be asking the
Yeah.
patients how to do it or
But
not.
the thing is, there was one plastic surgeon that lost her license because she did that.
Why?
Because they asked patients if I could be live, and then essentially they didn't. It was like undue pressure, and then the medical society thought that it was not ethical to do something live. So they took away. She was a plastic surgeon. They took away her license.
That's not right.
Yeah. But I mean,
Yeah, so I actually was considering that.
but I'm not sure if I could do that.
I think there's a little bit of a risk.
Yeah.
Yeah, I'm sure.
Yeah. Pinch.
Because I have access. I got to it,
Pinch. Yeah, I don't know. That's something gray area that I'm not sure I'm comfortable.
Yeah, maybe not.
Yeah. I don't think that many people do live surgeries.
I was thinking of TikTok live for info
For who?
time. Information. If you have any questions that you want to ask for Endolift or any
Yeah.
treatments, then they ask right away. TikTok live. That I was thinking about.
Yeah.
Feel that?
Mm-mm.
Okay. Yeah? No?
Mm-mm.
No, okay.
Does your daughter use AI for video edit too?
No.
No. Okay. Well, that didn't work.
No, she's so good, I'm telling you.
Well, she's doing it many, many years?
She just started.
She's just
Like last
talented.
year.
Okay, she's talented then.
She uses what? CapCut?
Huh?
She uses
CapCut?
I can't hear you.
CapCut is a video editing software.
No.
She must.
is-
Everybody does.
She's a bartender.
She's a what?
A bartender.
She's a
I can't
bartender.
talk.
She's a bartender.
Yeah.
But she knows how to do all this.
Yeah.
That's impressive.
Mm-hmm.
That's good. Maybe she has a second. What do you call it?
Exactly. Job.
Second career.
Uh-huh.
considering with the AI, you have to have a thing that can't be replaced.
I know.
You know, there's so many YouTube AI now, but I can tell the AI because it's the blink rate, the eye blink rate. It's never real.
Oh.
They have that robotic
they have a lot
blink.
of that, yeah.
Oh, robotic blink rate. Most people don't have that kind of consistent. It's just that's the odd part. If someone could fix that, that'd be good. But you can tell it's AI because of the blink.
Yeah.
I found that that's the most giveaway. Also, the face is too perfect.
Exactly.
No blemishes, no nothing. Okay, so we're good here. So I'm gonna work here. So far, it looks good.
Okay.
It's gonna look better and better.
As long as under my
Chin?
under my
The chin?
under the chin.
Yeah, I'm gonna put a lot of more energy in that.
Or under the
Yes.
jawline.
Okay, good. Thank you. Okay. So we're gonna go under the here. I'm gonna change the thing. Okay. Can you raise the table a little bit?
No.
Yeah, my back's hurting. Can you 여기 풀 해줘. Okay, too bright. Okay. Yeah, that's fine. Okay. Pain? You tell me pain. This side, you can hear more popping. Swallow for a second. Okay, okay, good. There's the thing. Good. Good. All right, good. Good right here. That's good.
Need me?
Not yet. Not yet. Okay, I got it. It's okay. Spray on there. Okay, good. Good, thank you. Over here. I'm trying to accent your corny angle here. So there's a little fluffy, so I'm trying to thin the skin around the angle of the jaw so make you look more thinner. Okay. Okay, that's good. All right, so now I'm gonna go work down here. Oh, I forgot to do the eyes. Yes.
Yeah.
I have to do the eyes. Just like I said, this is really gonna be very minimal. You don't have any bulge there. You had a bulge in the left eye.
Yeah.
This eye is just to
I just need a little
tightening. Yeah, tiny bit tightening. That's all. Spray here. Good, thank you. Yeah, because you have more hollowing here. So you don't need. Oops, you don't need to be aggressive. Yeah, burning. Sorry. It's just gonna be 1 or 2 passes. That's it. Yeah. Pain? Yeah. We wait. We'll do a little more here. Yeah. Okay. Yeah. Pain? Pain? Yeah, pain. Look a little more here. Okay, good. Give me a spray. Okay. Okay. Pain?
You know, you want to change the setting. You don't want to change the setting?
What's it?
Setting.
I will.
Ah.
I need to make it numb first.
Ah. I thought you numbed it.
No, I didn't. Okay, this is a little tiny bit. Tiny bit. Okay, because I'm
Yeah.
just gonna do a tiny bit anyway. Change the setting here. Okay. Spray jar. Good, thank you. Cold air. Okay, good. Good. You tell me if it hurts. Maybe a little bit. Once more. That's it. Maybe one more here. You could, if you want to get to the skin, you just point it more superficially. You tent it up, you get a little white spot there. That's good. So now we're gonna go to your chin, okay? Alright. Give me another give me a 10 cc and an 18 gauge needle. I gotta order these and get them low. Yeah. Okay, chin up there. Okay. If you're gonna do, then go closer so that it goes into here. If you did, when you're spraying, the spray goes like this. If I want it here. Oh, yeah, go closer so that. 여기 불 저기 해줘. Pinch. Okay. You feel it? Yes?
No.
No? Okay. Feel? No. Okay, good. Okay, it feels weird, okay? Feels weird. Okay, so there it goes. There it goes. Okay. Yeah. Not too bad. You don't
It's
probably feel it. Because I did it from here. So you feel less. Feel a little bit?
It's perfect.
Can you take the pillow off? Just take the pillow off. Can you raise your head for me? I'm gonna take the pillow off. Okay, good. There you go. Just keep your head up. That's all. Thank you. Spray, guys. Spray. Alright, a little bleeding. 그거 band-aid 없어요? 있어요. The round ones. We have. I gotta order.
To go out, get another box.
I'll just buy it from Amazon. It's okay.
Because we have Endolift. One.
What? Oh, I have Endolift. Another one? Oh,
It's gonna be an Endolift day on Friday this week.
okay. No problem. Okay. You feel a little bit. Okay. Good. Now I'm just gonna press it. I put a lot of anesthesia here. I'm just gonna push it so I can spread out the anesthesia, and too much water or liquid under the skin it kind of gets in the way of the laser. So I put it enough to make it numb, but now I'm pushing it so I can spread it out and thin it out, so that when I put the fiber optic cable in there, the fat and the skin absorbs it more efficiently. If you have water in there, it kind of gets in the way. So it's now less puffy. I'm just going to keep doing this. Okay, once we're done here, I'm going to just do the 2 bulges, okay? Alrighty. Where's your daughter living? Brooklyn? Here?
Babylon.
Babylon. Oh, Long Island. Okay. My daughter lives in Brooklyn, and she's paying $2,000 just for a room. I said, isn't that crazy? I said, no, that's normal there for where I live in Brooklyn. I said, really?
Yeah.
Wow.
It is.
That's a lot of money. She says, you're making enough to cover the rent? I go, yeah. Okay. I see. I said, wow, that's a lot of money. It's only a room, too. They're in a duplex. But I didn't know the rent that was going. Okay. All right, now I'm going to change the set. Oops. Let you bring it here a little bit. Towards me a little bit. Yeah. So I'm going to bring that here. Okay. So here we go. Good. Yeah, that's popping, right?
Mm-hmm.
Yeah, because I'm blending it. I'm less 1470, and I'm adding about 2 watts of fat melting. You don't have much fat here, but a little bit. I blend it, so I'm not as popping. Okay. Okay. So I'm going to give you instructions what to do. You have to do lymphatic massage starting day 2.
Mm-hmm.
Pushing the fluid to your ears, up the chin, down your jawline to your neck. Okay.
Mm-hmm.
I'll give you. There's a link I'm going to send you. You can follow the link how to do it. Then that will help drain some of the fluid. You're gonna get puffy.
Okay.
Okay. Spread. Good. Thank you. I'm putting a lot more energy here because this is the place where you want to thin out most. Okay, that's good. We're doing good. Okay, now we're gonna go to your bulge on your neck. Okay. Okay, good. Spray. Okay, so now I'm gonna unclip you. 1 second. I'm gonna take this off. Take this out. And then I'm gonna lower this. Okay, so the bulge is here. Okay.
Did you take anything off here? Because this has like.
I did.
Okay.
I went back in there. I saw that it was kind of full. I went back in there a couple of times.
Okay.
Yeah, this is your left side is fuller, even in your neck. So I went back here behind the neck.
Okay.
To try to accent the jawline. Okay.
Yeah.
Now, so I'm going to. Can you pick up your head first? Okay, good. Put your chin down. All right, good. Look straight. Okay, so. Okay, so you're here. I got it. Pick up. Okay, put your chin. Bend. Good. Straight. Yeah, there you go. All right, so it's here. I got you. Chin up. Good. So it's right here. Chin down. Okay, good. And you give me a skin marker. Now I have to buy a smear marker. Okay, good. Okay, good. Here. I get this. That's fine. Yeah. Good. Okay, there you go. Okay, turn over and pinch, 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 burning, 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 burning. There you go. Spray you. Very good. Pain? Over here. Okay, good. Oops, sorry. Burning. That's it. Okay, good. There it goes. Okay, good. Good. Alrighty. Turn over a little bit more. Thank you. Okay. 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 Come on. Nope. Sorry. That's good. Just a little bit more. Nope. Pain. Okay. And I'll give you a little more. Burning. That's good. Okay, much flatter. Good. Okay, good. Turn over. Okay, we'll do this side. Spray, please. Okay. Okay. Okay, spray you. Okay, we're almost done. We're going almost there. Pinch. Oops, sorry. Okay, good. We wait until it gets numb. Give her Keflex, give her Max ointment, and 20 milligrams.
Do you want the cushion out? The leg cushion?
No, it's okay. It
Okay.
doesn't matter. Yeah. I'm just like resting.
Pain?
Mm-hmm.
No pain. Pain. Okay. Pain? Pain? Okay, see? I ask you and you say no, but then you do. Alright, so here. Pinch again. Don't feel anything. Pinch. Pain? Okay. Okay, good. Ratio.
2:30.
Am I on track?
Yeah.
Okay.
Yeah. Hi.
Yeah.
You're on time.
On time. Okay, here's a little. Okay, a little bit. There you go. Little burning. It's good enough. Okay. Press it a little bit. We're almost done. Okay. I'm gonna clean you up. I have all these marks on your face, and we're gonna clean it up with your alcohol.
Okay.
And then I'm gonna put these band-aids on. Good. Next one is Zoom meeting. Beshia.
Starts at 3 o'clock.
Okay.
They're all in person.
All in person? Okay. All right. Good. All right. So. Okay, good. Thank you. Okay. Can you bring the pedal over towards me? Okay, thank you. Pain? No, good. Oop. It's okay. Oops. Pain? Okay. So much more flatter. Just a little tiny more. Okay, good. We're finished. Hallelujah. We're done. Let me clean you up, okay? Give me alcohol. Yeah, that's right. Okay, thank you. I'll give you a mask. This is skin marker. It'll go away when you clean your face. It may last not 1 day or 2 days, but as you clean your face, the marker will go away.
That I could bruise.
Bruise? Here.
Okay.
Not many places, but a little, at the entry sites, you may have a little bit of bruising, but not much.
Okay.
Yeah, no one, it's not crazy.
I hope your daughter likes the camera angle.
I know.
Because I'm not a professional for this. So
No,
I do what I can.
I know. I'm sure she could fix it.
Say that again.
She could fix it. I can't walk.
I know. I'm making fun of you. Yeah. The anesthetic makes it that way. It's gonna last for if you go to the dentist, same thing. About 4 hours.
Okay.
And it'll slowly come back. Okay. 몇 시간 한 거야 이거? 3시간?
2 hours?
2 hours? 2.5 hours. Yeah,
Not bad.
because I did, because the fiber optic was very efficient. Because if it's efficient, you can hear the pop. And if it's popping well, that means the fiber optic is good. There's always, I get a new fiber optic, but sometimes, they're not always exactly the same. Some are better than others. So if it's better, it takes much quicker because I don't have to keep doing more passes. If the fiber optic is a little weaker, I just need to do more passes.
Yeah.
And that's why it takes longer. In your case, the fiber optic was really good. It was really bright. That means that's why you hear a lot of popping.
Yeah.
That's why the surgery went fairly quick. Okay.
After the cleanup is done, when you sit down, let's take more photos.
Yeah, we're going to take a quick photo. I'm going to put bandages on. You want to do it before or after the bandage? Face picture.
Right now.
Huh?
Right now.
Right now?
Yeah.
You could do it standing up. Okay, I'm going to put you up. Okay? Head up. Good. Here. Then we're going to sit you up. And then we can take a picture. Okay, 1 second. Let me... You can take this out. Thank you. This is called Maxitrol, which is neomycin polymixed in dexamethasone, and this is a steroid antibiotic ointment.
Okay.
And I'm just putting the.
Are you putting anything on my face or no?
No, I'm just covering the holes with the Band-Aid. Okay. Right there. Okay. Now let me put bandages on. Can you bring the bandages here? Just put it right here.
So you're giving her antibiotics and steroid doc, right?
Yeah, I'm gonna give her a Keflex antibiotics to take twice a day with meals. Also gonna give her 20 milligrams of prednisone that will help her with the swelling.
The dry eye thing you can.
Oh, and also I'm gonna give her some eye drops for the eyes, because every time we do any Endolift for the eyes, patient gets dry. And the dryness persists about a month. I mean, because you have inflammation, we have accessory lacrimal glands on the lower lid, and when you do anything with the eyes, it creates inflammation. With the inflammation, you get dry eyes. So I'm gonna give you. Can you give her Restasis as well?
Do you have health insurance, Charlotte?
Mm-hmm.
Okay. Hopefully it's covered.
Yeah, hopefully.
You're sending
Eye drops.
you're sending it to my
Yeah.
Pharmacy?
Yeah, give the
Okay.
pharmacy information and send it.
Okay.
And when is the peak swelling, hopefully?
Starting day 2 and then 3 significantly, and usually third day is the worst.
Really?
Fourth day is about the same, and then fifth is where it kind of plateaus, and then after a week it starts to go down. So within the first week is where the most swelling happens. On day 2 and 3 is most significant. So on day 2 and 3, I want you to do the lymphatic massage. I want you to push the fluid into your ear. Same thing here with your fingers. Your eyes, you could do the same thing. Like gently, you can just gently push. But over here, like I said, this area is very confined, so the swelling may not go away with the massage. Under the neck, you push it up, go along the jawline, down the neck. And when you do that,
These areas are tight
yeah,
right now.
yeah, because we lasered it. So I was saying, by the second or third day, when you start seeing fluid, then you do the massage, and that will help with the swelling. And also yeah.
Face?
Take your time, take your time.
Face thingy.
Yeah, you have to buy that.
I have.
Oh, you have? Okay, you can put it on if you want. Well, sure. You put it on.
I have 4 questions today.
Okay. Okay, great. Thank you. Does she look even smaller already? Oh, my hat. Ooh.
And what can the clients do on themselves for the swelling?
I mean, like I said, do the lymphatic massage. That's the best thing. Try to sleep with your head up, best as you can. I mean, some people, of course, they sleep on the side, but if you keep your head up, then it helps drains the fluid from your face. But it'll just take time. But right now,
And what is this bandage for, Doc?
This is, yeah, this is you have to wear this bandage to compress the jaw so that when you, first it'll prevent some of the swelling from getting worse because it's a compression bandage. And also as it heals, it'll help the skin attach to the underlying muscle or the platysma. So you need to do this every day. Today you do it as much as possible. You're gonna do ice as much as possible. Ziploc bag, put a tissue towel around it and just do a lot of ice. Ice, ice, ice. And then put this on as much as you can. Always sleep with it on for at least 3 weeks every day when you go to sleep. A full month, just put it on when you sleep. And that will help you heal and make the jaw smaller.
And what are we offering for them for after?
Oh yes. So I also I recommend people to come 1 week later. I offer a procedure called physiotherapy. It's 980 nanometer laser skin therapy. So essentially, it helps the skin increase the circulation, and it helps stimulate the mitochondria in the skin. And that's gonna help you heal quicker. So come back in a week and I'm gonna do your full face, under the jaw, everywhere I did the Endolift. It helps the healing process. So come back in, perfect. Come back in 1 week and we'll do that. And then I'll take a pictures and you can always see, we'll see how you're healing. If you're on par or you look, I wanna see if you look great or not. I wanna see how much the swelling there is. I found out with the steroid, it's 20 milligrams. It's a little bit strong. I put a lot of energy in your face, the jaw, especially in your jaw, under the jaw. You're gonna be swollen, so I rather hit you with the strong steroid to get rid of the swelling right away, and you'll be much happier. Okay. Yep. Good. But right now, it's important ice.
Okay.
Yeah. Okay. And then also your lip wonky, yeah, 4 hours. That's the anesthesia. It'll go away. And tomorrow, you can do this for me later in the evening. Take a picture.
Today?
Yeah.
Okay.
Send it to me. You smiling, I'm not smiling.
Okay.
And then you can take a picture tomorrow morning. I'll see how you do.
I'll be taking a picture. I think I'm gonna get.
Can you get me the mirror? Okay, now, I don't know, you know your face better than mine. Do you think it's smaller now or it's about the same? It's not going to be that much different, but some people notice. Same? Okay, that's good. Same. This is swollen. This is tight. This is swollen. Swelling will go away. All the healing and improvement, like a month out.
Okay, and this part is just swollen?
Yeah, this is swollen. This is swollen. This is swollen. I put you see it's white. This is the anesthetic. It makes it white, and also the laser makes it white. Okay. So, I did that, and then like ice here too. That'll go away.
This color is.
Oh, sorry. That's betadine. I'll clean it. Let me clean it. Yeah, this is all betadine. Close your eyes. Close your eyes. There you go. This is betadine. That's why it's yellow. Okay, good. Here's a little. It's yellow up here too. So I don't want you to wash your face today.
Oh, really?
Yeah, wash your face tomorrow.
Okay.
You could do this. I mean, you can wipe it away with alcohol like this, but I don't want you to full water wash. And then, because I don't want the liquid to go into the hole. So you can wash your face tomorrow evening, and then replace the bandage.
Okay.
Okay. All right.
Thank you.
Okay.
Any chance of bruising with that? Bruising?
Well, I mean, some areas that I entered the skin, there might be a little bruising, and also when I put the cannula to get the numbing, sometimes I can create a bruise. You don't have that many. Only place I see possible bruises in the lower jaw. Yeah, that area. I saw a little bit blue there, but other than that, you don't have that much bruising. Yeah, we'll see you in a week. I think it will be good.